postnatal exercises. Today, I am super grateful to Baby Chakra for having given me this platform. And I'm sure there's so many new moms and moms to be who are a little worried about what to do with my baby. Can I do this? Can I do that? And we have so many opinions that we get from friends, family, neighborhood aunties. So, what is correct and what is wrong? Let's break some myths and understand the facts. Well, questions that typically come up are here's one: my mother-in-law does not let me massage my 1 month old. She says it's too early. What should I do? Well, she's not 100% wrong, but she's not 100% right either. The typical wait period for a baby massage is between 10 to 15 days, which is the time it takes for the umbilical cord or the stump to heal. So once the stump falls off, you can massage the baby. Standard used baby oil is coconut oil. If you're living up north, you can use mustard oil as well. Massage the baby very gently, no forceful pressure. And I recommend that the mother herself do the massage because that will give you a bonding with the baby. How much pressure should you use on the massage? Take your finger, press it on your eyeball. The pain that or the pressure that you can feel. It shouldn't pain, there should be pressure. If that is the pressure that you can tolerate, that's the pressure the baby also can take. So be very gentle, start from the extremities, go inwards and massage top to bottom. You may give a bath or you may also wipe the baby with a cloth. That should suffice. But make sure that the stump has healed. At under no circumstances should the stump be wet. Even after a bath, use a dry cloth to wipe that as well. One other question: should my newborn baby be tied all the time? As my parents say, if I don't keep her tied, her hands and legs will not have proper shape. That's absolutely incorrect. Tying is different from swaddling. You may swaddle a baby because it gives them that cocoon feeling like in the womb and is very comforting and soothing for the baby. वो अच्छा होता है. But tying a baby to give shape to hands and legs, not necessary. The baby will need to move hands and legs for muscle strength, needs to develop those movements, and it is advised that you do not tie the baby or even swaddle the baby super tight. Give them the flexibility to have movement around hands and legs. So at night, if you feel that swaddle does not stay, you may use something called a sleep sack. It comes with hands, without hands, but legs are there. You can zip it up so that baby is warm all through. There's another question: when to start baby massage for mother and baby? Now, for mother, massage is typically recommended after 6 weeks and after a clearance from her gynecologist. Whether it is a C section or whether it is a normal delivery, 6 weeks is a standard time period that usual that the uterus takes to heal. So we would want you not to do any vigorous massage during that time. However, normal application of oil on your skin is allowed. You can do that. But in case of a C-section, you have to get a clearance from your gynecologist that the C-section scar has healed, the sutures are all well done and healed, there is no infection, pus oozing out and pain in that area, redness, swelling and all of that. Once you have a clarity of that, you can do a massage. Again, the pressure of the massage should be tolerable. It should feel nice but not cause pain. So no pulling of hands, legs and joints. That does not really benefit either you or the baby. Now let's see. Should I cover my newborn's ear all the time, even in summers, to prevent him from catching a cold? Let's understand a cold first. Cold is not caused by cold items or cold air, it's caused by viruses. So, can you have a cold in winter? Yes, that's because there's air, a virus in the air, and that's what you and I are breathing, and so is the baby. But if you cover the baby's ears, the baby's body temperature does not get regulated because the temperature regulation happens from the baby's head. So you ideally want to keep the baby calm and you want to keep the baby comfortable. So if you want to cover and if you are feeling cold, then you want to cover. However, it's not mandatory. There are babies out there who prefer AC throughout the weather. Cold, winter, summer, doesn't matter. They prefer that cold because that's how the body is regulating, and it's okay. So you don't need to cover it all the time. But if you feel मुझे खुद ठंड लग रही है and it's cold, right? Then you need to cover the baby a little more. So it's one set of clothing for you plus one for the baby. Standard thumb rule. Another question: do we have to sharpen baby nose while taking a bath? Absolutely not. That's such a common thing. There's no point in pulling the baby's nose up like that. There's no sharpening. That's genetics. I have a blunt nose. My husband has a blunt nose. My baby is going to have a blunt nose. However, the reason they say that is because they had an assumption that because this is soft, the cartilage is soft, that they will be able to create that shape. In reality, you might cause more damage. Kindly do not do that. However, if you feel your baby's nose is stuffy, a gentle round motion, see how much pressure there is. I'm not squeezing it, right? I'm just gently round motion here around this area. Around this area will relieve your stuffiness. But don't pull and, shape in it. It doesn't work that way. What else is coming up? Do I have to compulsorily use a mustard pillow to ensure proper head shape for my newborn? And are there some other ways to manage the same? This is a good question. The shape of the baby's head usually is determined at birth, of course, genetics, but sometimes if there is a vacuum delivery, right, an assisted delivery for whatever reason, the baby's head shape may be distorted. So you might see an elongated head, or you also have babies who are lying down flat all the time on the back and they have a flat head at the back. This is called pachycephaly, and it is usually a cosmetic issue. However, if it does not correct it, it can lead to motor developmental issues, but you need to understand at what point to intervene. Now, a baby with a vacuum kind of a delivery typically does not require any help, whether it is a mustard pillow, whether it is a ragi pillow down south, uh, they do not need to be used. But what you should keep in mind are two things. One, do not allow the baby to be lying in the same position. Lying down all the time, then this part of the head becomes flat. Allow them to roll over, give them tummy time. So in before the baby starts rolling, you can put the baby on the belly, so the pressure is off that area. The baby is sufficient. You can do that 3 to 4 times a day, maybe more if the baby is comfortable. That will suffice. If there is already a shape defect, then I'd recommend you to talk to your pediatrician and a physiotherapist perhaps to check if there is a muscle tightness because of which the baby is maintaining that position and causing that flatness. That needs to be addressed medically. Any other questions here? Yes. Is kajal good for baby? Should I use or not? My mother-in-law keeps telling me it is good for baby. We have this idea of drishti, as we call down south, or nazar up north. I do believe it happens. However, kajal in the eye, not recommended at all. Kajal is made of chemical. And those chemicals can cause blindness as well, and that is a serious concern. The question then comes up: what if I use organic kajal? Will that be good? Well, we don't really know whether it's organic, first and the foremost. We don't know what ingredients are going into it. It is called organic, they have a certificate, they have a label, but are all the components in it, ingredients in it organic? We don't know. And, let's say you use it assuming it's good and it causes damage, then it is lifetime damage for the baby. So I do not recommend kajal in the eye. However, if you really want to go ahead and use a tika for nazar's sake or for drishti's sake, you may keep it on the side of the cheek there, and not on the face, because this is really delicate skin, somewhere which is not visible. However, do a test, apply it for 1 day, wait 3 4 days and see if that causes rashes or allergy. If it does, you need to stop. That is not good for the baby at all. There are some really good brands available for baby kajal, and none of those have been proven, at least by doctors. And also, I know of families who make them at home using a certain type of flower. If you have that, that is okay to be applied, somewhere behind the ear, not visibly seen. Please do that. It's okay. Do not use it on the eye, on the eyebrows. This area is super delicate, and the rest of the face is, the skin is so sensitive. Don't cause it damage. Um, can I give water to my 4-month old to fight heat along with breast milk as my mother denies it? While she's correct, do not give water. There is no heat for a 4-month-old baby. WHO recommendation and worldwide pediatricians agree that nothing other than the mother's milk for the first 6 months of a baby's life. They do not require anything else, not even water. Your breast milk is sufficient. You stay hydrated, you drink enough water, fruit juice, lassi, buttermilk, coconut water. All that liquid that you drink will transfer to your breast milk for your baby, and that is sufficient. All the nourishment, hydration, nutrients, minerals, whatever the baby requires, your breast milk will give it. In case you're not breastfeeding, then your formula will give it, but do not give anything extra until 6 months of age. Even after that, let us say you're living in a hot area, super hot area, we're talking about dehydration, a baby. In case you area which is extremely hot, your temperatures are super high, and you feel the baby might be dehydrated, then the recommendation is you feed the baby often. If you're feeding, say at 2-3 hours gap, feed at much lesser. Say 1 5 minutes. Say often. That's it. How do you know if a baby is dehydrated? Standard that must be 6+ times in a 24-hour period. You need to have 6+ P's. It's not 6 diapers, it's not it is 6+P's. Each P that a baby does is 3 to 5 spoons worth. Take a spoon, a tablespoon maybe, and 4 spoons of water, pour it in a diaper or a nappy, and see how heavy that gets. That's how much is 1 P. If you the baby's diaper is heavier than that, then the baby is definitely peed more than that. So 6+P's in 24 hours, baby is sufficiently hydrated. You do not about the baby's hydration at all. Not offer anything other than breast milk, or in the rare case of using formula, but do not offer water or solids or juice, tender coconut water, none of that to a baby less than 6 months. After 6 months, once you start, water is still going to be given only for oral cleaning, but not as a liquid to be drinking for hydration. Even then, breast milk is the source of nutrition and water content. Right? Let's see. Any other questions that come up? Okay. One last question that has there, and I'll answer that, is should I use a cloth nappy or should I use a diaper? Well, that's as simple as that. There is nothing good or bad. If you think you're going to save the environment and that's something that you follow, use a cloth nappy. But if you think it's too much of a hassle for you to twist and clean all of that, please go with a diaper. There's no harm one way or the other. Whether you use a cloth nappy or a diaper, the minute it is wet, it needs to be changed. So if you're using a commercially available diaper, you can wait about 3 to 4 P's, or you see that line that turns blue in some diaper brands. That's full, you have to change. But if it is not full, you need to change away within 3 to 4 hours of usage. Don't stay the entire hour period. All right. So with that, I end the session. However, your that is important for you. Some old tasks that we say, these are good and we need to take them sometimes with a pinch of salt. Some may be good for us, some may be bad for us, but they had their importance at that point in time. See what fits you, see what fits today's generation and the city that you're living in and your cultural background. If it does not, please do not follow them blindly. If you have a doubt, please ask other doctors, other mothers. Ask in a platform like Baby Chakra. There's so many people waiting to answer those questions for you and who will gladly help you. But do not do them just because someone told you to do. There's always need to be some kind of a understanding or at least a historical background as to why you're going to do a certain thing. But remember, babies are way more resilient than we know. They're much, much stronger than we think. And I suppose this is the best time of your life and you should enjoy that newborn phase. They fit into your hand and they're easy to cuddle and carry. So have that beautiful time with them. And for any other questions, I'm available in Bangalore and on Baby Chakra app whenever you want. And this